The study was presented at an oral abstract session at ASH 2022. So we are entering a phase where SARS-CoV-2 is becoming is endemic, and it's important to understand what are the implications for our patients who go into transplant following a SARS-CoV-2 infection. So what we looked here is we use this large data set, which is the National COVID Cohort Collaborative data set, or the N3C data set. So in this data set, we identified patients who underwent transplant for various hematological malignancies. The most common hematological malignancy was myeloma, lymphoma, and leukemia. Combined together, they were 82% of all the patients. So here we identified patients who had a SARS-CoV-2 infection going into transplant, and then we stratified these patients by timing and severity of SARS-CoV-2 infection with respect to BMT. What we found was patients who were transplanted within 4 weeks of SARS-CoV-2 infection, what we defined as acute SARS-CoV-2 infection, had an adverse outcome. And further, looking into the severity of SARS-CoV-2 infection, we found that patients who had moderate to severe SARS-CoV-2 infection had the worst outcome. So in this large data set, we were able to show that if possible, we need to reconsider the timing of transplant for a patient who's recovering from SARS-CoV-2 infection.